First off, let me say I loves me some David Pakman. Okay, I bought his book. I bought my dad his book. He's not a Democrat. He's obviously not a Republican. He's got a little bit of, he's progressive. He's got some libertarianism. He's got some humanitarianism mixed in there. He's a cocktail, if you will. He explains it better. But sometimes our wheelhouses bump up against each other a little bit. And while I agree with most of what David Pakman says, sometimes I need to add my 2 cents. I need to. It's not, I need to. I'm forced to. It's what I have to do. So he said some things over the weekend that I just wanted to comment on. Shall we?
We have a public health disaster in the making right now, and it's all because of Trump's authoritarianism. I'm going to explain it to you. Right now, May 2025, measles, hepatitis, salmonella, and listeria are spreading in the United States. You might be saying, David, sir, with total respect and tears in my eyes, what are you talking about? I haven't heard of that. The reason that you haven't heard about it is that the CDC, the agency that's supposed to keep us informed and help doctors and warn parents and give guidance, is barely saying a word. There aren't comprehensive updates going out. There's no alerts and health warnings. The CDC's newsletters have stopped. Their social media channels have gone nearly silent. They've missed publishing their own flagship disease report, the Morbidity and Mortality Weekly Report, for the first time in over 60 years. So you would be right to ask, what the hell is going on here? What's going on is that since Donald Trump returned to office in January, his administration has slashed thousands of jobs at the CDC. Entire teams have been fired, including the people who handled public communications, social media, health alerts. The CDC can't post to its own Facebook account, to its own Instagram account, because the people who had the passwords are gone.
Okay, first, David is absolutely correct. Most of the social media from the CDC has been pulled. I just checked. There's not much, if anything, in the last few weeks. However, with tears in my eyes and respectfully, David, the morbidity report is still being published. You have to go to the CDC to get it. I wasn't a subscriber prior to this, so I'm just now seeing it for the first time. But I can put in, here it is right here. I can put in my email address to get on that list. So that's an option. And don't forget, there's 2 other places you can still get your alerts. Number 1, the Health Alert Network, right here. This is actually an official arm of the CDC, so it's 100% official. It's actually on the CDC's website. You can go here and you can get all of your important health alerts. Look, I found listeria, I found salmonella, I'm sure whatever you need to find. And look, down here, you can also subscribe for updates. So perhaps, they might have lost all their newsletter email addresses, all the, access to those servers and everything. It could be possible that that's what happened, but maybe now they need to build that all back up. So please go and subscribe. And finally, don't forget that you do have the FDA.gov. I know it's not ideal. They've also lost some people, lost funding, cuts. The FDA isn't always the best on reporting, but the very least we can do is sign up for food recall alerts. Again, that's where you're going to find out about your listeria, E. coli, salmonella. You're going to find out what companies, see right here, you're going to find out what companies they are associated with, what the packaging says, like the manufacturer number on there, the ID number, that if it's in your pantry, you can pull it. I haven't been reporting on food recalls, but I absolutely freaking will if you guys want me to. I didn't think anybody cared, but it is important, and especially the whys. The whys are important here. But I digress. Back to you, David.
And the kicker is that even when the CDC does try to get a message out, it has to be approved by, you know who, Robert F. Kennedy Jr., the vaccine conspiracy guy who has somehow ended up as the Secretary of Health and Human Services. So instead of telling you what foods might be contaminated, where is measles spreading, how do you prevent it, get a vaccine, how to protect your kids from hepatitis, the CDC's social media is posting vague fluff about Bobby Kennedy Jr.'s travel schedule. It's not a mistake. This is the plan. This is what they do. Step 1, sabotage the agency. Look at the Postal Service or the IRS. Of course it's broken. You broke the thing. And finally, they do it with public schools. So that's the process. Step one, make it work like crap. Step two, complain it's not working. Step three, say, we shouldn't even be funding this. Let's just privatize. So they're doing the same thing with public health. Gut the CDC, make it non-functional, turn around and say, it's bloated, it's useless, let's shut it down. And the most depressing part is that voters keep falling for it. People will get sick, some will die. As long as their side wins.
So this is a narrative lately that has been happening a lot, that, you know, the administration is trying to cut these government organizations at the knees, reduce their funding, reduce their ability to research, reduce their ability to reach the public. Therefore, we look around and shrug and go, what the heck, man? What's with the CDC? What's with the World Health Organization? Why are we, they're useless. What are they there for, right? And then the government swoops in and goes, hey, we've got a great idea. We're gonna make this an economic indicator from now on. They're gonna say privatize it, but we're gonna fund it differently so that it can stimulate the economy. It's all great, right. Which would be horrific in the sense of the CDC, because my question is this. First a statement, then the question. The statement is this. Let's not forget that RFK Jr. ran on the Democratic platform far before Kamala Harris was even in the race. He's been a Democrat for years. I mean, who would it be? What would that even look like? The healthcare insurance companies? Good luck with that. The big pharma companies, they got the money. They're sneaky as hell. They would probably try, but not on my watch. Big food? Nah. And I don't think big food would ever be in charge at the CDC. It's like putting Exxon in charge of our EPA, which, God, you never fucking know, right? But seriously, that is a question I propose. I propose to David. I propose to the audience. What would that look like if the CDC got privatized? Yeah.
And this is how democracy breaks down. It's how a country lets public health collapse in real time, because there's a political movement, MAGA, that is more interested in controlling the message than protecting people's lives. So we've got to live with the consequences, and people keep falling for it. Now, that's the Republican model. They're applying it federally. What can you do? I don't want to encourage people to abandon red states, but the blue, well-funded, functioning states have their own versions of the CDC, that they can't do everything the CDC does, but they can at least work to keep people informed. Listeria, salmonella, measles, whatever the case may be. So I'm not saying go and move to a blue state, but there is no doubt that in a sense, blue state governments are a sort of bulwark against the insanity that we are seeing at places like the CDC.
David, thank you for the shout out. I don't mind if I do. Yes, here in California, we have a very robust public health reporting system. Here are just a few. We have our California Department of Public Health. I'll put the website down in the description. We also have our own California Health Alert Network. We have our California Department of Education. You guys can look and see what's going on in that area too. We have our local health departments like our LA County Public Health. And finally, this is a big one. We have our Office of Environmental Health and Hazard Assessment, which evaluates health risks from environmental contaminants. So, yeah, if you're thinking about moving to a blue state or not, feel free to use our health reporting systems. We're happy to serve.